Hi, my name's Natasha Lee, and the vulnerable population I chose is active combat veterans and their health concerns. My husband is active duty Navy, and I currently volunteer at the military hospital, so I thought this would be a good population for me to look into. On my first slide here, I have a profile description of combat veterans. I took a definition from a website that I've cited here. It says combat veterans are those that serve in any United States military branch and experience hostilities of any level or take part in an action of enemy combatant for certain duration as a result of friendly, defensive, or offensive fire military action that involves a perceived or real enemy in a post or predetermined combat proceeding. So basically, anybody that has served in war, been in combat. Next would be the size of the population. I pulled these facts from my cited resources. In Provo, there are 2,221 veterans. In the whole state of Utah, there are 143,771. And then in the United States, there is 20.4 million. And I wasn't able to find the amount of veterans internationally. I'm sure that would be a little bit hard to pinpoint. The population size locally significantly smaller than the national number of veterans. I'm assuming this is because our veteran population consists of men and women from all over the United States and U.S. territories. Next would be contributing factors, social determinants of health. So with social determinants, the four that I picked out were quality of education and job training, social support culture, availability of community-based resources. So with quality of education and job training, a lot of the time the military experience does not always equal civilian job experience. Military have a hard time transitioning. Everything changes for them, their responsibilities, their jobs, communities, lifestyle, healthcare, training, and so much more things, especially if they have a spouse and children. They no longer have support from federal what word am I looking for? From federal, I guess, like federal assistance, because it's no longer just at the fingertips like it once was when they were in. Let me think. It's also just hard to translate that experience and for civilian employers to understand what military did while they were in. For social support, family loved ones not understanding the trauma experience. So a lot of the time, military members have their division or group of people that they work with, or something people would call a band of brothers, people who understand everything that they've been through. They understand each other's hardships. Once they get out, they no longer have that. They feel that their family does not understand. Next would be culture. The military has its own culture of not seeking help because it's seen as weak. I know my husband has various shipmates that have anxiety or stress but refuse to go seek help because they're afraid that if they do, others shipmates will find out and their business will go around and they will be seen as weak. Next is availability of community-based resources. Military members come home to communities, not federal agencies. So with that, I feel like the Defense and Veterans Affairs should work more closely with state and local governments. These veterans don't come home to federal agencies, and they come home to communities, and a lot of this falls on the shoulders of the county and city organizations. So military bases and VA hospitals should look for ways to share information and service with their state and local counterparts to better serve our military members in the community. Next is contributing factors, specific concerns, and root causes. So I decided to do physical, psychosocial, and economical concerns and their causes. So I found on medlineplus.gov that there were various different injuries that military members end up with once they get out of the military. Some can be physical stress, some can be mental stress, and some can even cause disabilities. For physical, there are gunshot wounds, loss of limbs, head and brain traumas, hearing loss. For psychosocial, being separated, being in the military and being separated your family can be stressful, so it can put service members at risk for mental health problems. They can experience anxiety, post-traumatic stress disorder, substance abuse, depression, and suicidal ideation. For economical, a lot of them come home and experience unemployment, poverty, and homelessness. From thinkprogress.org, the unemployment rate is 6.9% for veterans compared to the national average of 7.3%. And I also found that female vets have a higher rate of homelessness than their male counterparts. For poverty, I found that more than 986,000 veterans under the age of 64 had been in poverty during the previous year of 2010. They also, in 1 in 5 households that rely on low-income home energy assistance programs, 1 in 5 have a veteran in it, and they also rely on food stamps. Then with homelessness, San Francisco did a study back in 2012, and they found that more than a quarter of their homeless population had served in the military. And the Department of Housing and Urban Development estimates that over 62,000 veterans were without a home. And although a lot of them tend to be male, the female veteran homelessness is population is growing. So for contributing factors in Maslow's hierarchy of needs, let's see. So the needs met by this population would vary from having all their needs met to none. So I'm kind of just going to quickly go over how their needs change from being met and to not being met once they get out of the military. So if they're in the military, all their needs are being met. For physical needs, they're being given assistance for food, assistance for housing. So they're never being without food or without a roof over their head. And for safety needs, there's job security. It's very hard to get fired within the military, as well as a continuous paycheck. They always know that on the 1st and 15th, they're going to get paid. For love and belonging, it goes back to that band of brotherhood that they have. They have a division or a group of people that they are continuously with, and that becomes their family. And if they do have a wife and children outside of work, then that also meets the love and belonging. For esteem, the military provides sense of opportunities to grow. They're put in difficult situations, harsh environments, and they learn to be resilient, as well as they're always encouraged by those around them. For self-actualization, some military members can meet this point as well. If they decide to stay in and they continue to grow and take exams to rank up, then they can end up high ranking and can engage in some serious personal growth and have some peak experiences. So while those all are met, once they get out of the military, they're no longer receiving this housing allowance. They're no longer receiving COLA. They're no longer receiving the medical insurance and dental insurance for themselves and their family members, nor are they receiving the basic housing allowance for subsistence, which is assistance for food to buy groceries. They're no longer receiving any of this, especially if they're not retired. They're definitely not receiving that medical or dental insurance. So it's a huge transition for military members. For anticipated functional level, it all would depend on the individual and the resources they use. It would depend on what kind of job they had while they were in the military. Will it transfer to a civilian job? Likely health outcomes. That also depends on how badly they were injured while in combat. Are they able to get out and find a job or not? It depends on if they seek those resources to also rehabilitate. For specific concerns, communicable diseases, infections, The publichealthva.org lists 9 infectious diseases that a military member could have received if they were in the Gulf War, served in Iraq, or in Afghanistan. So those 9 are right there. Then specific concerns, non-communicable diseases or infections. I found that the 4 main chronic diseases are cardiovascular disease, chronic respiratory disease, cancer, and diabetes. I found that with these 4 things, the military has worked hard to prevent these and then also to rehabilitate members. They have lots of programs that address risk factors related to smoking, physical inactivity, an unhealthy diet, obesity, hypertension, hyperglycemia, and things like that. They found that, they can prevent these things if the military members take advantage of these programs. But once they're out, they are also able to be seen at a VA for screenings, get immunizations, get behavior counseling, go to weight management programs, receive health education, and for for chronic respiratory disease, there's also resources for veterans for smoking cessation. They screen older adults and heavy smokers. They try to follow them and, track them with patients with nodules and, like I said, continue those screenings over time. Next is specific concerns, self-care and self-harm. So I found on research news for the U.S. Department of Veterans Affairs, I found that with veterans, they have found to be doing non-suicidal self-injury. Some of those would be burning and hitting themselves, as well as suicidal ideation, being passive or active. So passive would be, saying things like, I hope to fall asleep and, not wake up. Or an active would be actually performing or trying to physically kill themselves. So those are the specific concerns related to our combat veterans. They need to receive further counseling with that. With this website, they also started an assessment for suicidal ideation, and they created a formal training so that providers can better identify those at risk for suicide long before they make an attempt. So that's going to help our military members. And then for specific concerns, risk to harm to others, I found that a study was done in 2015 in the US and the UK, and they found that aggressive behavior was found to be a common problem among service members exposed to combat. So whether it was physical assault or violent aggression. And then next is my references. Thank you for listening.